Good morning. Thank you, Mayor Price, and good morning, mayors and distinguished guests. Welcome to day two of the African American.
Good morning. It is my pleasure to welcome you to day two of the African American Mayors Association 2021 virtual annual conference. On day one of this conference, we covered topics such as building inclusive prosperity through entrepreneurship. We talked about broadband infrastructure and reimagining public safety. Today's conference is going to be just as exciting. Please note that all sessions will be live streamed via Facebook and YouTube and will be available on those platforms for future viewing. Thanks to the AAMA mayors and the Business Council members joining us today. Please feel free to post comments in the chat. We also want to thank our conference sponsors. Our presenting sponsors are AT&T, Ewing Marion Kauffman Foundation. Our diamond sponsors are AARP, Casey Family Programs, Cities United, Wells Fargo, and Comcast. Our quick fire chat was sponsored by CTIA, International Well Building Institute, Starbucks, Verizon, and Waste Management. Our gold sponsor is United Airlines, and our silver sponsor is ShotSpotter. The theme of this year's annual conference is Forward Together, Mayor's Vision for Resilient Communities. Throughout the two-day conference, AAMA will virtually gather mayors from across the country to discuss building and deepening relationships and developing creative solutions to strengthen communities in the times of change and uncertainty. Today's first session is Leadership During the COVID Era, a look back and look forward from vaccine education to broadband access, and is sponsored by our partners at AARP. So without further ado, I now welcome COVID vaccine education and multicultural engagement lead at AARP, Nii-Quarterlai Quartey, who will be moderating the session.
Good morning. Thank you, Mayor Price, and good morning, mayors and distinguished guests. Welcome to day two of the African American Mayors Association 2021 virtual annual conference, Forward Together, Mayor's Vision for Resilient Communities. I'm Dr. Nii-Quarterlai Quartey, COVID-19 vaccine education and multicultural engagement lead at AARP. The impact of COVID-19 on Black communities has been staggering, revealing and exacerbating longstanding racial disparities in our health and in our economy. And at AARP, we believe that this is absolutely unacceptable. In fact, from AARP's perspective, the disproportionate impact of the pandemic on older people of color is tragedy. Considering that nearly 95% of COVID-19 deaths have been people over the age of 50, and around 40% of all deaths have been among nursing home residents and staff, with Black and Hispanic nursing home residents dying at 3 times the rate of other residents. There's new CDC data that shows that the life expectancy in the US declined by a full year in the first half of 2020, the worst decline since World War II. Even more troubling, the average life expectancy decreased by 2.7 years for non-Hispanic Black people. Now, the vaccination distribution is underway across the nation, and we've got to continue to push harder to make equity a top priority. But we also have to do the work to make sure that Black communities are just as much a part of the recovery from this pandemic as other communities. And in this session, Leadership During the COVID-19 Era, a look back and a look forward from vaccine education to broadband access, AARP and the African American Mayors Association have partnered to bring together an esteemed panel of mayors to discuss how they continue to lead their cities through these unprecedented times and the challenges of ensuring an equitable recovery. Please join me in welcoming to the virtual stage no stranger to AARP, Mayor Steve Benjamin of Columbia, South Carolina, and Mayor Wayne Messam of Miramar, Florida. Mayor Stephen Reed of Montgomery, Alabama was scheduled to join us, but was not able to, and so he sends his regards. But we want to thank you all for being here today. Welcome, gentlemen.
Thanks for having us.
Mayor Messam, I want to start with you. Miramar, Florida has a pretty significant senior population, and Florida has been in the headlines throughout this pandemic. And I want to give you an opportunity to start off by reflecting on your leadership and some of the lessons learned from leading a response to the pandemic, particularly among seniors.
Well, thanks so much for having me here today, as well as the representation of the city of Miramar. As many of the mayors across the country may know, South Florida was the epicenter of a lot of the COVID-19 cases that was experienced over the last year. And with Miramar being at the heart of South Florida, equidistance between Miami and Fort Lauderdale, it not only caused us pause, but it really heightened our awareness and our activity to ensure that our city was safe. And among our residents, our senior population was the most vulnerable. We have a very active senior program in the city of Miramar, where we provide a plethora of social services as well as quality of life benefits, because they're very active, very accustomed to interacting, going on field trips, and being a part and ingrained in our community. So one of the first things we did was to ensure that some of the basic services and necessities were met. We quickly instituted a food distribution program to ensure that our seniors had food to eat in a safe manner. We've partnered with Feeding South Florida, as well as working with our social services department to do home deliveries for those seniors who didn't have transportation to get the bag drop and go stopping points, where we made distribution points throughout the city. Second, we wanted to ensure that wellness visits were made, because initially, before you could even get a COVID-19 test, you had to have a referral from a physician. So we knew that maybe some of our seniors may not have had healthcare coverage, so we did not want that to be a barrier. I worked very hard with the state of Florida to ensure that the city of Miramar had our own testing site, and we were able to get one located right in this a walk-up site, in fact, in the heart of the community, so our seniors and other vulnerable populations could access that. And finally, we wanted to make sure that our seniors would not be threatened by shelter. We provided rental assistance. We also provided utility bill assistance, just to make sure that the quality of life and the basic necessities, as we got a grip of COVID-19, as we were in the middle of the storm, we wanted to ensure that not only our seniors were safe, had masks, able to visit doctors, but to get tested if they needed so.
Same question for you, Mayor Benjamin. In Columbia, South Carolina, can you sort of reflect on your leadership and some of the lessons learned from leading response to the pandemic, particularly among some of the seniors of Columbia, South Carolina?
Sure. Thank you, Dr. Quartey. It's an honor to again be with my colleagues at the African American Mayors Association. Thanks to Mayor Price for his leadership. It's always great being with my friend and brother, Wayne Messam. And Doc, you and the AARP, I will tell you that the journey we've been on the last decade together has been an amazing journey. And I'm so thankful for the partnership here with AARP. Always keeping it very real about what we're dealing with, but always looking forward. I think even the way this panel is framed, the fact that we're talking about vaccine education and we're talking about broadband access, we're obviously recognizing where we're coming from, but recognizing that the new normal that we're looking forward to can't be the same as the old normal. That there are some significant challenges, some significant disparities that were illuminated in a very significant way during the pandemic. Speaker recently said the pandemic served almost as an X-ray of American society that revealed so many broken bones. And obviously we understand the challenges as relates to our senior population that were illuminated so painfully during the last year, which I told a group in Knoxville the other day that last year actually serves as 7 years. It was a dog year. It was a dog year without the warmth and love of a dog. It was 7 years. So Wayne, we've been in office a lot longer than we think we have. The last year, obviously, like some of you, like Wayne City and some of us, we stepped up very significantly, recognizing not only very early on, the data showed us that our senior population was being affected in a much more significant way that our Black seniors and brown seniors across the country were being hit even harder in the early days of the pandemic, a large-scale national crisis where very early on we had very little information. We did our very best to follow the data that we had available to us and use that data to give us good intelligence, use that intelligence to create good policy, being driven by our one true north. Our one true north was the preservation of human life. That's it. We endeavored to build strong intergovernmental and intersectoral partnerships that would help us use our bully pulpit of the mayor's office to just push information out as much as possible. And as we waited for the first wave of COVID relief from the federal government, we decided, just as Mayor Messam said, just to take action on the local level. We know that things happen in cities. Sometimes they don't happen in DC. Sometimes they don't happen at state capitals. But mayor and local government officials are on the ground, and we realize we see a need, and that's why developing partnerships that help us get hundreds of thousands of meals out to seniors, that lever partnerships between some of our wonderful AmeriCorps Vista volunteers and interns. We use them to pull together a partnership between some of our young people who are making some tough decisions in life, whether to take the road less traveled by or the road that's well worn, and put them together and put together a senior wellness network in which we stayed in contact with hundreds of seniors through the mayor's office to make sure that their needs were being met as it relates to nutrition, or at that point early on testing opportunities. We did in our most challenged area of the city, where some of these healthcare indicators that served as a predicate, quite frankly, for mortality, were very real. We've obviously, through our Meals on Wheels and Senior Resources Program, delivered probably well over 500,000 meals across the city, again funded with city money, understanding that there would be some major challenges coming as the pandemic unfolded. Again, I'll close this opening volley with where I started. It's a recognition that the old normal was not very good for a lot of people in our society. So we have a really an opportunity for an incredibly sizable, exactly how we're going to prepare for this new normal. Some of the data that you mentioned, maybe Mayor Price. It was actually you, Doc, talking about life expectancy. I mean, we've watched a number of different statistics over the last several decades on life success and financial success. Start dropping off in the last 10, 20 years. So how do we use this opportunity going forward around vaccine education, vaccine access, around broadband access? Probably the greatest silver lining that's come out of the pandemic is the belief that digital infrastructure is actually a right that we all should enjoy. How do we use this window to make sure that all of our citizens, and particularly our seniors, quite frankly, who help build the country in which we live right now, have the opportunity to live strong, fruitful lives that get, thank God, being extended in many ways, and hopefully in cities like Columbia and Miramar.
There's so much there, Mayor Benjamin. I want to stay with you for 1 second, and I appreciate the metaphor that you just shared around the pandemic really acting as an X-ray and revealing America's broken bones. You also talked about data, and one thing that I often say, no data, no justice. And so keeping that in mind, what's the COVID vaccine state of play in Columbia, South Carolina? And have residents turned the corner on vaccine hesitancy? Are access issues prevalent for some communities more than others?
You know, I think as your question suggests, um, uh, there's a whole lot more we all should be doing. I think we're seeing about 32% vaccination rates. Obviously, we got to get that to 70, 80%. But we're in line where a lot of the country, particularly the South, is right now. There's a lot more work to be done. We're still seeing some hesitancy, or at least a whole lot of folks who are kind of still taking their wait and see approach, and trying to develop some sense of urgency in getting access to the vaccine. We know, again, as your question suggests, that universal access and equitable access are two very different things. So how do you ensure that people have access to the vaccines? And yes, if possible, the vaccine that they prefer in a very easy way. So we're going to spend some time actually at the city council meeting today looking at a couple of more innovative approaches, stealing ideas, the very best ideas from my colleagues all around the country, including places like Mayor Turner's efforts in Houston, and which they're doing door-to-door vaccines. They launched some efforts in that regard. But if people want to go to the vaccine, we're going to take the vaccine to the people. And we're also launching a wonderful effort with our barbershops, just really trying to make sure that some of our men, we're seeing a significant number of actually young men who are also not seeking access to the vaccine. And we got to do a deeper dive and just keep on pressing. So our numbers again are still lower than they should be, not far from the national average, but just got to help again. In God we trust. Everyone else bring me data. The Deming quote I think is important. Data gives you a measure by which you can determine your success. And then if you can take that data and humanize it in a way and tell stories. So often we're driven by the anecdotes and not by the data. If you can find a way to take that data and wrap it up in stories that help people understand the importance, what it means to you, your family, not only your health, but your prosperity, long term, then hopefully we can start seeing a much deeper penetration rate and acceptance rate of the vaccine. It is the way out of what we've been dealing with the last year and change right now. So hopefully we'll start seeing these numbers tick up, and we're going to do everything we can to push them up.
Thank you for that, Mayor Benjamin. Same question for you, Mayor Messam. What's the COVID vaccine state of play in Miramar, Florida? And have they turned the corner on vaccine hesitancy, or are access issues more prevalent for some folks in Miramar compared to others? Mayor Messam, I think you're on mute. That's all right. It happens to the best of us.
Okay, great. I think that the admin in the background muted me. I wasn't aware. But anyway, just like Mayor Benjamin stated, we are nowhere where we want to be in the city of Miramar. Currently, right now, throughout the city of Miramar, depending on zip code, we range anywhere from 33 to 39% of the population vaccinated. That compares to 53% of Broward County. And in some other cities where it may not be as black or brown in those respective municipalities, they're looking at percentages upwards of 70+%. So as you can see, we have a long way to go. Our approach is just because of the lack of access to vaccines initially. Our focus had been on getting our seniors and those most vulnerable with comorbid conditions vaccinated. So as many mayors may know across the country that may be online right now, South Florida is very densely populated. It's contiguous from West Palm Beach all the way down to Miami. So there's a big demand and a lot of just intra-competition for vaccine sites. So it took us about a month to get our own vaccine site within the city of Miramar. We have been successful in setting up pods where we were bringing vaccination sites directly to churches, right, so that our residents could have easy access to them. We knew that many of our clergy leaders who would be supporters of the vaccine, that their congregations and those that supported those churches would follow suit or would be a big influence. But our number one focus was to make sure that the vaccines were available for those who wanted to get the vaccine. Now we're entering into the phase of getting our medical community as well as other spheres of influences to provide the right information to our residents. When you're thinking about getting a vaccine, it's a personal choice because it's dealing with your health care. And we want to make sure that we're providing data, we're providing facts, and we're providing the right trusted individuals and putting them in front of our residents so they can balance the facts and the importance of getting the vaccine so their entire community can get back to what we used to know as normal, to be able to motivate them to get vaccines. Because the fact of the matter is we're fighting a lot of phobia. We're fighting a lot of historical challenges that have happened in the past. Our community is very diverse as relates to, there's a lot of Caribbean Americans, African Americans, Hispanic Americans from the Caribbean, Central America, and South America. All are here, and you have all of these cultures, all of these biases, and all of these perceptions that we are competing against. So we're really using spheres of influences from each of those respective communities for all of those demographics to show why it's important. We have a major regional campaign going on, and it's called I Did It, meaning that I got the vaccination. So we're using faces and voices of people who look like everyone in our community, showing the fact that I got the shot and this is why I got it and this is what it means to our community. It's so interesting to know that when COVID-19 first sparked as a pandemic, one of the first rumors was that African Americans and people of color aren't getting impacted by COVID-19. It was a big farce. And in fact, we were the ones who were being dealt the biggest blow because of many reasons: lack of access to healthcare, or even perhaps some comorbid conditions that just exacerbates the situation of contracting COVID-19. So we were able to help dispel a lot of those rumors and getting people tested. Now that we can get them tested, we want to get them vaccinated. And it's definitely a heavy lift, and it's something that the community as a whole is rallying behind so that we can improve our numbers to keep our communities safe.
I just want to lift up a figure that you shared that really paints a picture of sort of the challenges we have around an equitable response to this pandemic. You had said at the top of your remarks, currently Miramar the vaccination rate ranges from 33 to 39%, compared to 53% for Broward County, and some places in the neighborhood upward of 70% vaccination rate. And so it's interesting that even in that footprint, you see such a great disparity. What a call to action! Thank you for sharing that, Mayor Messam. I want to transition the conversation and really connect the dots between vaccine education and high-speed internet. And Mayor Benjamin, I want to ask you, how has access to high-speed internet, how has it helped Columbia, South Carolina, weather the pandemic, and how has it limited access to high-speed internet how has limited access to the internet, how has it made the pandemic more difficult for your constituents?
Sure. The internet, the information superhighway. Again, I think the silver lining of the pandemic is the fact that people on every side of the aisle, I wish there were just two sides of the aisle. Now there's several, recognizes that the infrastructure of the 21st century is indeed digital infrastructure, and we have a window of opportunity now in which we can find some really thoughtful public partnerships, but anchored by real federal investment that build out that infrastructure. The existing digital infrastructure, I think, as Mayor Messam indicated, I think our community, particularly those represented by us on this call, also suffer from a significant amount of misinformation and disinformation on the internet. There was a time Dr. Quartey, you and Wayne are younger than I am, but when you can go on TV at 6 o'clock at night, and all the information that was to be shared, that your show could share with you earlier that day, we'd all get the same information at the same time. Now you have people getting information from so many different sources, literally dozens of sources, and some of it, quite frankly, is information that just doesn't mean you well at all. And then, obviously, to the core of your question, usually. Historically, I should say, when people talk about access to the discussion has more so been about urban versus rural, urban suburban versus rural. The reality is that even in the core of many of our urban areas, there is not access to ubiquitous broadband or wireless internet. And this represents a real opportunity for some aggressive partnerships that, first of all, make internet access available, and then secondly, make it affordable. And there are a number of different efforts being led by my Congressman Jim Clyburn and several other members as they pull together this infrastructure package to make sure, again, it's accessible and then it's affordable for folks all across the country. Because if you got to sign up for online through any number of these different platforms you use, and you're first of all not a digital native, and then you have to struggle to get access. The only way you can get access might be on your cell phone, not on the desktop or what have you. It significantly early on limited a number of folks being able to access those early phases that were obviously set aside for some of our older citizens. It was a real challenge and remains so. I will tell you again, the silver lining. I've seen some amazing partnerships emerge. I mean, we pulled together a partnership with some fantastic business leaders here, some faith leaders, in which we rolled out Wi-Fi in our most challenged census tract in the entire city that faces so many different issues. We rolled it out to make sure that not only could people access the platform for vaccine access when it became available, but also the school children who live there would have the ability to stay home and still receive their educations. It is the predicate, just as access to electrification that changed the world in the 1930s. It is a predicate to true economic opportunity and the city's vitality going forward. We'll have a little window here where we can pull together those smart partnerships, public, private, philanthropic partnerships with a real partner in the federal government. Wayne knows very well that all the infrastructure investments we make are usually local investments, maybe state investments, but 80% of the investments in infrastructure historically have been done by state and local government. The federal tax code to our advantage, but very little money coming from Washington. We have a window now where the focus is there, and we've got to jump through it to the overall benefit of our citizens.
Can you humanize this conversation just a little more and sort of anchor it into what looks like high-speed internet as infrastructure, what that looks like in Columbia, South Carolina? I think sometimes when we talk about infrastructure, I think there's some folks that just stop at roads and bridges and what has traditionally been infrastructure, and they don't think about the small businesses, or they don't think about the caregivers, unpaid caregivers, and how they have to utilize internet to perhaps work from home a few days a week to care for their loved one. Can you humanize high-speed internet as infrastructure in Columbia, South Carolina?
Absolutely. When you think about the lives that we lead, I'm not sure if I know Wayne. I've met Wayne's kids, but let me tell you what: you let the internet go down in my house, Wi-Fi go down, and then you think it was World War III or something like that. Do anything, and we live in the homes of relative privilege. But if you're talking about almost anything that you want to access as the world transitions to digital, now as we think about how AI and automation and advanced machine learning is already changing the world in the old normal, last year accelerated that trend by at least a decade. So 2031 came to 2021, and almost everything that you need to do, if it's shopping online to get your medicine that you might not, if you have challenges getting around, you have to get on the internet to have access to that. If it's, again, education, high quality education being delivered into our homes to our children. If in fact you do have access to the internet, you can order your food online. You can shop for groceries online. You can have access to Uber and Lyft and whatever it is just to help you deal with mobility issues. But infrastructure is literally everything from roads, bridges to if you turn that faucet on in the morning to get some water in your coffee cup. If you flush that toilet to make sure that stuff goes where it needs to go, or just flipping the switch to ensure that your electrical grid is up and running. I mean, these are the investments that we make every single day that are, quite frankly, defining of a developed nation. If in fact you don't have well-funded infrastructure, then in the 21st century, it's impossible for you to truly participate in American democracy. It's impossible for your business or your small business to grow without having an online presence that allows you to open up your markets in meaningful ways. And I will say this too, because I'd be remiss if I didn't. And I've talked about this on the AARP in the past. As we endeavor to build truly age-friendly cities, and we often talk about attracting millennials and Gen Zers and everything else, 50 to 60-year-olds are the most innovative and entrepreneurial cohort in American society right now. Start more businesses than any other age cohort. You think about the resources there, the experience there. If we're going to build cities that attract this amazingly talented pool of individuals, you got to have digital infrastructure. I mean, you got to have the ability to help people grow their businesses. You think about this cohort again, the 50 to 60 marketplace pre-pandemic was a $7.6 trillion marketplace. Of course, there's different measurements with GDP, but if you took that as gross domestic product, that's the third largest economy in the world. The U.S., China, and 50 to 60-year-olds in the United States. So being able to build a thriving city for the next several decades means that you've got to have real digital infrastructure that allows your business and commerce, allows you to now worship online as we still do in our family, allows your kids to be educated, allows you to get wonderful healthcare access as well. It is sacrosanct to our future as a society.
Thank you for that, Mayor Benjamin. Mayor Messam, how has the digital divide made the pandemic more challenging for your constituents in Miramar, Florida?
Well, it was a mix. It was a mixed challenge. Miramar being a developing suburban community, we're actually Florida's 13th largest city, rapidly growing. So we have the benefit of a lot of new infrastructure, but we do have a historic side of our town where many of our residents have that's the working class community, and those may be a significant number of seniors as well. But humanizing what this impact of COVID-19 has done, if you think about it, to set up a test or to get a vaccination, what was one of the main avenues to be able to do so? Registering online, right? So if you don't have internet access, that could be a barrier. So for our seniors, we quickly identified those who are in our network to understand what their connectivity issue was. So for those who were without high-speed internet, we were able to leverage our city staff to ensure that we arranged their appointments. We took them to their tests, we take them to their vaccinations, and in some cases actually brought the test and bring the vaccinations to their homes for those who aren't physically able to make that trip. So that's bridging that gap. Because the city has been investing in our high-speed backbone throughout the city, all of our city facilities, not only within the facilities themselves, but in our parks, we have high-speed internet activity and access points throughout our city in every neighborhood in our community so that residents can have access. Now, I know that most of our conversation has been more focused on our seniors, but one of the programs I launched out of the mayor's office was leveraging our existing relationship with Comcast in their Internet Essentials program and providing free internet to our elementary, middle, and high school families that were without high-speed internet, so that now that many of our students were taking online courses, we didn't want that digital divide to impede the educational progress of our students. So those were some of the many ways we were able to assist our residents. Now, one of the big assets that made the city of Miramar very attractive to land our own testing site and our own vaccination site was because of this infrastructure we had in place. Because every vaccination site, every high-speed, every COVID-19 testing site, one of the requirements was to be able to connect to a high-speed internet connectivity so that reporting and information could be exchanged from that site to the state of Florida Department of Health for reporting purposes. So because we had that infrastructure in place, it was an easy sell for us to make that case why we needed the ability to be able to reach our residents. And we also leveraged the data when the CDC first came out with the report that African Americans were the most impacted from COVID-19, and we didn't have a site to test our residents or a site to provide vaccinations. We leveraged that data to say that this is why we need to have this site, opposed to going to other communities that perhaps every community needed it, but I had to make the case for my city and my residents to ensure that our most vulnerable was able to have access to those resources.
Wow, so much happening in Miramar, Florida, and Columbia, South Carolina. We're preparing to enter the Q&A segment of our discussion. And so for the folks that are streaming in, please remember to use the chat box feature to ask questions of Mayor Benjamin and Mayor Messam. Before we go to questions in the chat, I have one last question for the two of you. And I'm going to start with you, Mayor Benjamin. You know, right now between and you touched on a lot of this, but I want to give you an opportunity to add anything that you feel like adding. Right now, between the emergency broadband benefit (EBB) and the Biden-Harris administration's proposal to make historic investments in high-speed internet, how might these investments really make a material difference in the lives of the residents of Columbia, South Carolina, particularly the senior population in your city, which you've noted, are leaders in starting businesses, particularly that 50 to 64 cohort.
Sure. There's so many different discussions and levels of debate going on at the federal government. Most of them, I think, very healthy around this space. Again, the idea that that this is now that digital access is a predicate to prosperity for all Americans. It seems that people have coalesced around that fact. We've got to make sure. First of all, we got to figure out kind of where we are. Most of America, most people have no idea what's currently in the ground in terms of horizontal infrastructure, fiber in the ground. We've got the dark fibers there. So a lot of folks will probably go wireless, and wireless being a bridge to true broadband access as we build out these wonderful ubiquitous networks that give everyone access. I would hope that as the federal government looks at making what will be certainly long-term, but also strategic investments, that we think very carefully about what types of partnerships that we can have. This is not only meant to be a place where the public sector invests. This should be a smart public-private partnership, but obviously public-private partnerships must, if there's going to be public action and public resources, the public has to come first. So how do you work closely with amazing companies like the AT&Ts and the Verizons of the world that have existing infrastructure, and some of the newer companies that are looking to build out wireless networks as well. How do you use these resources very effectively to make sure that we take this shot in a way that endures long term? We're not making these investments for 2021. We're making them for posterity, for 2031, 2041, 2051. So how do we act very aggressively? And again, I think it starts with smart in the sectoral partnerships that includes folks like AARP at the table, but it starts very much as this new administration has very already admitted and invested with those of us on the local level, working closely with mayors, who understand our communities, putting us to work, helping us to work on the plans for our regional areas to help deploy these new digital assets. But it's gonna require a lot more chess than checkers. We can't just throw money out there. We've got to find ways to truly build partnerships that lever the resources and the expertise of the private sector and balance it with true public sector needs. You can come to my downtown and build out as much infrastructure as you possibly can, but you're going to have to go across the tracks too. How do you use the levers of public policy to make sure that you have those balanced investments so that we can all win and grow together?
Thank you for that, Mayor Benjamin. And Mayor Messam, I want to share with you a question from the chat. How do you engage your fellow mayors in smaller towns with a traditional way of leadership to embrace a more forward-thinking policies and activities? This question is from Shanquetta Shade Cunningham, and she says that she lives in Arkansas, and she says our communities are dying out for various reasons, and we have to acknowledge the role leadership has in the process, along with our systemic factors as well.
Yeah, that's a great question, and oftentimes, mayors who may be in a more urban environment where there's a lot of innovation that's going on and a lot of development and expansion, and we can quickly not even think about some of the challenges that are going on in rural America. Therefore, like the question that just came in. But I guess the best comparison that I can give is that mayors who may be in more urban settings and more of a metropolis area, we have similar challenges as it relates to getting infrastructure built out into some of our more depressed areas where there's not a fiscal incentive for the private sector to bring infrastructure out there. And I think that's where our federal government, our state governments, as well as some of our local governments can give more of an incentive to the private sector, partnering with them to perhaps make it more or incentivize that activity to broaden out into these areas that may not necessarily be more desirable for them in terms of what may looks good initially on the balance sheet. Because once we're able to get infrastructure out to rural America, once we're able to get more infrastructure and high speed and connectivity out to our more depressed areas, it really now puts those residents and those individuals in the game. One of the things that we realize here in the city of Miramar that, the definition of work is changing. It's not more so you coming in and punching in the time clock to check into work. It's you waking up, going into your living room or your dining room table, logging in to clock in, and you need to have that connectivity. So with our city and rural communities can do this too. See where it applies, where you can adopt smart city concepts, where you're really looking into how you're going to get innovation into your community. Think outside of the box. It may not be there now, but begin to plan for it now and make the case, because when you do so, you not only can the data that results from that Like for our seniors, for example, we have a big effort in terms of implementing even more GIS, where we know where our seniors are located, so we know where to direct services. We're by us knowing where our seniors are, we know what needs they have, and we can more efficiently provide it to them. We're partnering.
Yes, and we very much appreciate all of the best practices and next practices that are coming out of Miramar, Florida. I would like to thank Mayor Steve Benjamin of Columbia, South Carolina, also Mayor Wayne Messam of Miramar, Florida. Mayor Steve Reed of Montgomery, Alabama was unable to join us, but hopefully we'll catch him another time. I want to thank you both for participating in this really insightful discussion where we've attempted to connect the dots between all the valiant work that's happening on the COVID vaccine education front and ensuring an equitable response to the COVID-19 pandemic. I also want to thank you for being so forward-looking, connecting those dots between COVID-19 and the potential for our communities related to high-speed internet. AARP is proud to partner with the African American Mayors Association in this meaningful work today and moving forward. We want to encourage people to go to aarp.org/coronavirus for all the latest information in all states across the country related to the COVID vaccine. We're constantly updating that site with the latest information from the CDC and from public health departments and other officials across the country. That's aarp.org/coronavirus. Now, please stay tuned for AAMA's annual Legacy Award taking place at 11 a.m. Eastern.